Okay, so there's a really interesting history about the naming of influenza, and the two big ones we worry about in humans are influenza A and influenza B. There is a C-type virus which just doesn't cause very severe illness, and D, which only occurs in cattle. Interestingly, you've heard about swine flu and avian flu and bird flu. The type A is basically from a broad category of species, birds and other wildlife. Of note, one of the funny things about influenza B is it comes from ferrets and seals. I don't know how we got that. Influenza is a virus that can be quite severe. It's not like the normal cold. It actually comes with very high temperatures, severe muscle aches and pains. And last year there was almost 250,000 cases diagnosed in Australia, and 30,000 of those resulted in hospital admissions. So it's a severe virus. Been around for thousands of years. The worst bout was in 1918, which some reports say killed up to 100 million people worldwide. But this year, the big thing about it is that we have government funding for vaccination of children, which is a new thing. The bigger thing about children is, unfortunately, the influenza virus has a big effect on previously healthy kids. And unfortunately, when they do get admitted to hospital, it's usually a more severe case. It is true that when it comes to deaths from influenza, it's more likely in the 65 years and older category. They're more likely to, unfortunately, have fatalities. But young children, usually under the age of 2, but certainly 5 and under, can have more severe short bursts where they have to go to the hospital and sometimes to intensive care. And that's why they're trying to target that group. The other point is that children 5 years and under tend to be a big reservoir of influenza virus and spread it. And that's a thing they're trying to contain this year and see if that reduces the effect on the community. With every vaccination there's local and systemic risks, but there are millions of doses of influenza vaccine that are administered throughout the world every year, and it's one of the lowest risk vaccinations. Everyone will have some tenderness and pain, mild temperatures, localised redness at the site are the most common side effects. We always say that if there's ever any concerns about a reaction, to present and see your GP or call us on the phone, but generally it's an incredibly well tolerated vaccine.